Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to the website, missionmatters.com, and click on Be Our Guest to apply. All right, so today I have Dr. Blair Masters on the line, and he's a founder of AcuSmart.com. Blair, welcome to the show.
Thank you for having me. I really appreciate it.
All right. So excited to get into today's topic. So gaining control of your health through AcuSmart. So excited to get into the app and how it's helping people. But before we do that, we'll start this episode the way that we start them all with our Mission Matters Minute. So Blair, we at Mission Matters, we amplify stories for entrepreneurs, executives, and experts. That's our mission. Blair, what mission matters to you?
You know, at AcuSmart, our mission is to bring wellness to the world. And there are so many things that we've learned lately that have to do with natural healthcare that people can go down to the health food store or order over the internet and do at home that can make a huge difference in their health. And we want to educate people on those things, what they can do to basically be more well. And when they're well and their family's more well, it makes their community more well. And then that makes the world more well. And that's bringing wellness to the world.
It's awesome. Love bringing mission-based individuals and entrepreneurs on the line to share why they do what they do, like what excites them about their work, their profession, and their mission. So great to have you on. And I guess let's just start kind of towards the beginning. So how'd you get started really on this journey? I mean, you come from, I believe, a long line of healers, right?
Yes. I'm the third generation chiropractor and third generation acupuncturist. And I'm the ninth chiropractor in the Masters family. So we've been healers, as you said, for a very long time. And we focus on nutrition and exercise as well as chiropractic. But what the AcuSmart app is really kind of about is about acupuncture and applying that. And when I say that, people are like, whoa, acupuncture, that's scary. We recommend people do what's called electroacupuncture, or they can even just like rub or tap the points that we recommend in the app. So it's not near as scary as it sounds.
Yeah. So we'll dive deeper definitely into the app because I have many more questions on that. But I got to take a step back. I can't let you off the hook so fast. What was it like growing up in a family of healers? Like how is that like? I mean, I ask this question many times when there's like multiple generations of entrepreneurs and things like that, where it's like, what was the dinner conversation like, or the holidays, right? How was it growing up like around a family of entrepreneurs, healers?
Well, you know, my dad would talk about this case or that case, you know, or around the dinner table. And I always thought it was fascinating.
Yeah.
And, you know, I never really thought, I'll become a chiropractor until I used to live in Iowa. We went to Minnesota to go skiing and we ate at, I don't want to drop any names, but we ate at Godfather's Pizza on the way home. And by the time I got home, I was buckled over in pain. I couldn't stand up. My stomach hurt so bad. And my dad helped me out. And I thought, man, I want to be able to do that with my kids. And that's really when I decided to become a chiropractor as well. And it really kind of blossomed from there. I've been in practice here, moved to Arkansas. The weather's a lot better here than Iowa. And have been in practice for 34 years here in Northwest Arkansas, and started the app like we were talking about earlier.
I find the chiropractic profession just really fascinating. I mean, one of my really good buddies in LA, he's a chiropractor known for years, Dr. Ben, LA chiropractor. I mean, I find the community of chiropractors, and I also obviously he brings on new chiropractors to his office and all these things. And I just find the community of chiropractors it's just an amazing thing. And so the reason I bring that up to you is maybe there's some people out there that haven't really considered, or they want to help people, but they haven't really considered chiropractic as a career, or maybe they've heard of it, but they don't know, they don't know what it's all about specifically. Like, what kind of things would you tell them? Because you have a unique vantage point and a unique insight just being around it.
And it is exciting how much more we know now than we did when I got out of college. I mean, they are doing more and more research on what vitamins are needed and that sort of thing. But chiropractic in and of itself is a healing art that encompasses the entire body, because we're making sure the nervous system that controls and coordinates all the parts of the body is working properly. And if it's not working properly, you're going to have problems. And chiropractors help that work better, help that control system work better so the body can heal itself. And when you combine that with acupuncture or the knowledge of nutrition that we have now that we didn't even have 10 years ago, I can think of like 6 studies they've done just on vitamin D since COVID came out, and how important it is to have vitamin D levels up really high for infection. It's just very exciting how much new stuff is coming out.
I completely agree. And I just happen to know just a little bit about it, again, being around the community. That's why I want to bring that up, because I think it's really interesting. I want to transition a bit. So let's go we'll do a deep dive into the AcuSmart app, but maybe first let's start with just some of your thoughts on having like healthcare and having a philosophy of health. Like, how should people be approaching that just in general?
Man, that is one of my really big things and one of the reasons I did the app is because I see people applying a health philosophy that just doesn't work. And essentially kind of the default health philosophy of people in America and in the modern world basically is, oh, I've got a health problem, I'm going to take some kind of pill to help it.
Yeah.
And they are coming out with new drugs and medications all the time. And thank heavens, because a lot of those really do help quite a bit. But you can't, it's funny in our society, we say, oh, if you want to be healthy, eat right and exercise and have a positive mental attitude. Yeah. But then when you get sick, they say, oh, if you want to get over getting sick, take some meds, take some medication. So it doesn't really kind of make sense. If you're in a situation where you take a natural approach, you can help almost anything that is out there health-wise. And like diabetes is a classic one. Diabetes and heart disease these days are basically lifestyle diseases. They're not something you catch or something that you'll get from someone. They're based on your lifestyle. And you can change that if you change your lifestyle to start taking some vitamins and that sort of thing. And some people decide, okay, that's for me, I'm going to go do that. And some don't. And that's up to them. And that's okay. But I think it's so important that you have a strong health philosophy. And we use 2 triangles in our health philosophy. And one is what we call the funnel of health. And you think of it as an upside down triangle. You're kind of at the top and you're floating around at the top of the funnel, and you start having some kind of a health challenge and you drop down into the funnel, and maybe you're doing self-care first. And a lot of people do this. They have some ache or pain or ailment, so they do self-care, and maybe they'll take a vitamin, maybe they'll take a Tylenol or an Advil, or they'll put an ice pack on, or they'll stretch or whatever, self-care. And the next level down is like alternative healthcare. Oh, I'm achy, my back hurts, I'm going to go get a massage, something like that. Or I'm going to go to the chiropractor, or I'm going to go to an acupuncturist, these kind of alternative healthcare things that are non-invasive and don't, when you see a commercial on television for them, they don't have a huge list of symptoms that could happen if you take the drug. Well, the next level down, say, oh, my back is so bad. I went to the chiropractor, I went to the massage therapist, I went to the acupuncturist, didn't work. My next level down would be, okay, I'm going to try some medication. I'm going to try a steroid injection, a painkiller, or something like that. Yeah. And then the next level down from that is, oh, I need surgery. I need to have a surgical intervention. And then you drop out the bottom of the funnel and you're dead at that point. But one of the problems, as I see it, is people jump down the funnel. And you can understand if people are scared when they have a health problem, they don't understand, they get afraid, and that's a normal reaction. But they're like, oh, this is the worst thing that's ever happened. I'm going to jump down. My back hurts so bad, I must need surgery. I'm going to jump down and have surgery right off the bat, instead of trying these other levels that many, many times can really get you back up to the top of the funnel where you're healthy again. And our society's default health philosophy is, and diabetes is a good example of it, like you get diagnosed with diabetes and you're down in the medication area and you never leave. So people stay there their entire life. They stay there their entire life. So they kind of live in this, I don't feel great. I don't feel horrible. I don't know what to do about it. I'm just taking this medication. And their health just continues to get worse and worse. And then the other side, I don't know if you want me to talk about the triad of health now, but
one moment. I do want to get into the triad of health, but before that, so the point here though, and that I'm hearing is if we're thinking about this funnel, you start at the top, you maybe go further down, and the symptoms or the treatment may change. But the idea here is really like that there can be, depending on using your diabetes example, I mean, there can be help. Like there can be changes, there can be behavioral changes, which we'll get into with the AcuSmart app in a moment. But there's changes that can happen that can kind of help alleviate you from that funnel. Like there is hope, right?
Oh my goodness. Yeah. I had a patient who he came to me for one visit and his blood sugar level is 362 which is crazy. It should be like no more than 100. It should be like 85 to 90, but his was 362. This guy was under huge amounts of stress. He slugged down soda pop all day long. And his A1C, which is it's a blood test for diabetes. And that should be in the 5 area, around 5. His was 12.3. And full-blown diabetes. Didn't even know it. He just knew I feel horrible all the time. We got him on a significant diet changes and a number of different vitamins. And it was a significant vitamin regimen, but he had a kind of a secret weapon, and that was his wife. His wife was like, you ain't dying on me, so I'm going to make sure you eat right. And the next time I saw him, which was in about 3 months, his blood sugar level was in the 80s, from 362 down to 80. And his A1C was 5.3, down from 12.7, or I don't remember exactly what it was, but huge drop by changing his diet and taking vitamins. And, if there was a drug out there that could do that, basically we got rid of his diabetes, or he got rid of it by following the recommendations. If there was a drug out there that could do that, they would be advertising it every other commercial on television. It probably cost thousands of dollars a pill. And, it took a lot of work. I don't want you to get wrong. It takes a lot of work. It's not just, I'm popping a pill every day and going on about my life. You got to change your lifestyle, but absolutely, you can make changes in any health problem.
It's a great story and a great example, and didn't hurt that he had a wife that said, you ain't dying on me. So
yes, exactly. Yes.
So that'll help as well. All right, so let's get into this other concept. So triad of health you mentioned. Go ahead.
Okay, think of a triangle, and we all sit in our own triangle. Okay. And we look at 6 things that can cause health problems. We look at structure, like the bones and the joints and the ligaments. We look at toxins. We're taking those in our air and our water and our food. Nutrition has 5 parts to it. It's what you eat, what you drink, hormones, infections, and prescriptions. And then there's allergies, emotion, and your acupuncture system and how that's functioning. And again, if you're in the center, you've got to figure out, well, what is the underlying cause, or what direction do I need to approach my health problem from? And if we go back to diabetes as an example, like let's say you are in a situation where you have diabetes and you just start doing a prescription, but you don't change your diet, you're never going to get rid of it. And it's probably going to continue to get worse and worse and worse. Or back pain is another example. So many people have back pain, and instead of approaching it from a structural standpoint, which is the vast majority of back problems, my muscles got strained, or the bone's out of alignment, or it's pinching a nerve, or whatever, they take a medication, which isn't even in the structural part of it. It's completely the opposite. Well, how many drugs does it take to get the pinch off the nerve?
Right.
It's never going to happen. It's kind of like taking your car to the mechanic and saying, "Hey, I need an oil change," and he realigns your tires. It doesn't fix the problem, and it may help your car, but it's not going to realign the tires. It's one of those things. So you got to approach the health problem from the direction the cause is coming from. And well, we'll get into the AcuSmart app down the road, but we focus primarily on their acupuncture system, nutrition, and emotion. Are those three? I think that's a great transition. Actually, let's dive into the AcuSmart app. So first off, just tell us more about the app. Well, I was watching a commercial on television for this condition called non-24, which is actually quite rare, but they were advertising this medication for it. And I thought, man, I know exactly how to fix that problem with acupuncture. The problem is you got to stimulate different points at different times a day. And I went and talked to an electronics guy I know to make a device that would do that. And he said, well, why don't you just make a phone app to tell people when to stimulate what points? And I was like, oh, eureka. Why don't I do that? So I started.
Hold on, wait a minute. I have to stop you. So you were watching TV, you saw a commercial, and you're like, oh, I got it. This was the moment?
Pretty much. I know how to fix that problem they're getting a drug for. Yeah.
I love stories like this. Go ahead. Like the moments of like inspiration. I just love stories like that. Please continue.
Anyway, so that started me down this journey of basically trying to do a information dump out of all the information I've gained in practice over 34 years and putting it in the app. And essentially we have over 100 different symptoms that have acupuncture points that are associated with helping those symptoms. And these points have been handed down from generation to generation over thousands of years of acupuncturists. And then we've got a section that is questionnaires, and we cover 10 different body parts, 10 different body systems. And these are like in-depth questionnaires, and then they get a score. And it's some things that you might not think about. Like we have a cardiovascular, which is obviously a very important system, but in alternative healthcare and through studies that they've done, they found like seeing a crease in your earlobe is a sign of heart disease. So we ask that question as an example of like picking up on symptoms that you might have that indicate problems with these 10 systems. And then we give them a score. When they fill that out, they get a score as to how good they're doing on a percentage basis. And on top of that, a page of recommendations, do this with your diet, take these vitamins for this problem, and that sort of thing. And then the symptoms section, like I said, we have 100 different symptoms. And then we have a learning center, and this has lots of videos in it on diet. There's a lot of focus on emotion. The more I deal with people's health problems, the more I find that a lot of them have an emotional component to them. And again, there's lots of research out there that kind of backs that up. But we try to teach people techniques and methods that they can improve and influence the emotions that they have and help the health problems that are resulting from that. So anyway, it basically has those big three parts to it.
Tell me a little bit about the user experience. So let's say, I'm watching this right now. I'm sitting at home, I'm watching this interview, and I'm like, oh, this sounds interesting. Let me download the app. Like, take us from there. Like, what's next?
Well, they'd sign up and essentially make an account. And then the first thing I encourage people to do, if you have a goal, you want to accomplish something, you kind of need to know where you are. And that's what the questionnaires are for. We ask you, and you can either fill them all out, or you can fill out ones that happen to be maybe a family history or ones you're interested in. There's male and female and cardiovascular and structural and all sorts of different ones. But that gives you an idea of what kind of a grade you're getting in that area of your health, as well as some action steps that you can take to improve it from diet and lifestyle and that sort of thing. And then they've got kind of a where they are, and then what do I need to do to improve that? Well, go to any symptoms that you might be having and set up a stimulation schedule. Say they, using our diabetes as an example, they may have, diabetes affects the whole body. They may have a number of different systems that are not functioning properly. And then they may have a number of different symptoms. And let's say they have 3 or 4 symptoms. They'd set up a schedule to revisit that. I don't recommend doing it less than once a week, but more often is usually better. And then the app will remind them. They set up when they want a reminder sent. And then they sit down at a time that's convenient for them and perform their stimulation. Then I really recommend going into the Learning Center in depth because it covers a lot of different bases. I've got a kids section. There's lots of people who are like kind of freaked out when their kid complains and they run to the ER or the pediatrician for things that really you can take care of at home. I've got a bunch of videos in there on kids' problems, how to affect some of the main ones like, oh, my stomach hurts or my head hurts or whatever, what you can do about those things with children.
So let's say, I'm a parent, I'm at home, my kid says, my stomach hurts, right? So then you'd open up the app and then you look in the Learning Center, like give me a little bit of a flavor for that experience. Because I think it's a great resource and it's really just a great tool for somebody to have in their pocket.
They can search children and get all the videos of that, or they might search abdominal pain and children. And I used my granddaughter in it and showed how to do abdominal massage that helps things like constipation, or another thing that most people haven't heard of, but it can cause a very acute problem. And actually, that's the problem that I had when I ate the Godfather's pizza back when I was a kid, was a problem with what's called the ileocecal valve. The ileocecal valve is a valve between the large and the small intestine, and it can malfunction and cause a lot of pain. The scary part is that the ileocecal valve and the appendix are right next to each other. So a lot of times a problem with the ileocecal valve is mistaken for the appendix. So people run off and have a surgery instead of massaging the valve, which is what they need to do to get things working properly. But I show exactly how to do that. And then I show how to stimulate the spine to get the nerve supply better to that area of the intestines as well. So there's a number of different resources, but you got to consider too that what the kid ate earlier is maybe not agreeing with them. So you might want to change their diet a little bit as well, and take a kind of a holistic approach when it comes to your health or your child's health, either one.
What kind of response have you heard from the app so far? Like what kind of feedback have you gotten? I'm curious.
I've been really excited about it. I've gotten people to take a look at it all over the country at this point, but the majority of them have been my patients. I've been talking to my patients about it and that sort of thing. The patients that I see every day here in the office, and they've been really excited about having a resource that they don't necessarily have to run off to the doctor to get help with things, which anytime you empower people to take responsibility and take control of their own health, I think we're doing good for our nation, really, and the whole world. If you're having fewer problems and having to go to the doctor less, that's always a good thing.
Yeah, I like it. I'm all about empowerment when it comes to your health, your healthcare data, like how it's being used, like just what you're doing in general with it. And also the more you can do at home, or the more that you can treat that when it's simple, right? Like when you're at that top of the healthcare funnel, as you described earlier, like that's a big deal.
Yeah, absolutely. And the more you can do to create buoyancy for yourself so you don't get sucked into the funnel, the better off you're going to be.
Oh, great. That's a great example. Don't want to be sucked in the funnel if you don't have to be, right?
No, exactly. And it's nice we have it available if it's needed. You break your leg or something like that, the emergency room is the best place to go.
Yeah.
But, your kid comes up to you and says, oh, I've got a stomach trouble. That might not be where you want to take them right off the bat.
Yeah. Well, Blair, I just have to say, like, it's been great having you on the show to learn more about some of your concepts, your background, by the way. I mean, amazing. Coming from a family of healers, taking that insight, teaching, of course, the funnel of health, triad, and then also now taking all that knowledge and doing that. I can't even imagine what it took to do that brain dump, so to speak, and put all that knowledge, all that learning into an app for the benefit of others. I think it's a great story, an amazing story. So what's next? I mean, what's next for you? What's next for the AcuSmart app?
Well, I continually work on it and add more things. Like I had a patient today say, oh, can you add a section on narcolepsy, which is not a real common condition, but is very devastating for people. But, if people download the app, it's both in the App Store and the Google Play Store, both for any kind of device. If they download the app and sign up for a year, we're going to send them a free, and it's free shipping in the United States, a free electroacupuncture device that they can use to stimulate the points that are in the symptom section. We're planning on bringing out in the future a device that people can actually take readings from their acupuncture system and get a more in-depth analysis of what's needed. But that's coming down the road a little ways. That's going to take some development for sure. So we're really excited about that. But what I'm really excited about is bringing the app out, getting lots of people to start utilizing a health philosophy that supports them and empowers them to be healthy and stay healthy. So we can bring wellness to the world.
It's a great story, and we will put all of that information in the show notes for everybody watching this, just so you know, so that you can just click on the link and go to the store and download that app. And if somebody wants to just continue to follow your journey and the evolution, just in general, what's the best way for them to do that?
Well, we have a YouTube channel, and they can go to AcuSmart.com, which is my webpage, but you've got to download the app from the Google Play Store or the Apple App Store as well. Yep. Those are the places to get it. Yep. But my website, AcuSmart.com, would have info on the app and details on that.
Fantastic. And we'll put all of that stuff in the show notes so people can just go check it right out. And speaking of the audience, if this is your first time with Mission Matters, we're a platform that's all about bringing on entrepreneurs, executives, and experts that really have something to share with the world. Like what wakes them up in the morning? What gets them passionate to go out there and make a difference in the marketplace? If that's the type of content that you're into or that excites you, we definitely recommend that you and welcome you to hit that subscribe button, because we have many more mission-based individuals coming up on the line, and we don't want you to miss a thing. And Blair, really, it has been a pleasure having you on the show. Looking forward to see the app and the evolution, and just to continue to follow your work. So thank you.
Well, thank you for having me. I really appreciate it.